Our brain relies on alignment of our body parts in order to access certain muscles. When you're pregnant, your abdomen changes, your rib cage changes and spreads, your hips change. So, when you're in the postpartum healing phase, it is important to do exercises that help you reconnect your body with your brain to this new alignment. The very first thing we're going to start is the breathing exercise. We covered that in the first month postpartum. If you haven't had a chance to see that video, I would encourage you to go back and learn that breathing because the next exercise is going to build up on that breathing exercise. You will be laying on your back with your knees bent, and we're going to try to find our deep abdominal muscles. In order to visualize the deep abdominal muscle, imagine a corset that goes in your midsection, right at the base of the rib cage, all the way to the pelvis, from the front all the way to the back. We have another abdominal muscle that is right in the middle, rectus abdominis, which is the six-pack muscle. We often think that is the core muscle. That's the muscle that helps us do sit-ups. We're not trying to find that muscle. The one we're trying to find is a deep core muscle. It's called transversus abdominis, and it is closest to your spine. In order to find that muscle, you will go back to the breathing exercise, where we start with inhale through your nose, exhale through your mouth. Once you have figured out that inhale and exhale, you will focus on perineal lengthening through the inhale, exhale and engage through the perineum. Once you have figured that out, you will try to find the abdominal muscle. So, inhale through your nose. As you exhale, you're gently squeezing your pelvic muscles and tightening your lower belly. In through your nose. As you breathe out, squeeze the pelvic floor in the front, squeeze it in the back. It helps to visualize a marble or a blueberry that you're drawing up inside your body using the muscles of your perineum. Tighten the lower belly like you're zipping up a really tight pair of jeans and keep pulling that zipper up. Feel free to use your hands to notice the tension that builds up under your fingers. And relax. Once you have practiced this a few times and feel confident, start to add hip movements. Inhale and gently open your knees. Exhale and close your knees. Inhale and relax. Open your knees. As you get ready to exhale, think about that pelvic floor activation. So squeeze the Kegel muscle. Think about pulling a blueberry up into your body. Tighten the lower belly muscle. Keep squeezing as you keep bringing your knees back. Once your thighs are parallel to each other, relax the core muscle. Inhale through your nose and open the knees. As you exhale through your mouth, start squeezing the pelvic floor in the front. Squeeze it in the back. Think about pulling it up in your body. Tighten the lower belly like you're pulling your hips together. Keep tightening the abdominal muscle all the way up like you're wearing a corset and somebody tightened it. Once your thighs are parallel to each other, relax. And repeat. It is intuitive to think that you need to do 1,000,000 Kegels because you had a baby. However, Kegel muscle is like any other muscle in the body. It needs to be able to squeeze when you want it, and when you're done using it, it needs to be able to relax. So don't forget to relax. Not everybody needs to do 1,000,000 Kegels. Keep in mind to not focus just on the perineum, but also use this deep abdominal muscle. The belly muscle and the pelvic floor muscle need to talk to each other, and this is more a coordination exercise than a strength exercise, to coordinate your breath with your hip movement, with your core activation. Some people need to practice this for 1 week and they get it. Some people need to practice this for a month. Listen to your body and take your time. I always encourage patients to count when they're doing this, or speak or talk, because we tend to hold our breath. So make sure you're breathing. And relax. Feel free to progress this exercise. Once laying on your back and doing this exercise is easy for you, turn on your side and introduce some gravity. Same exercise. In through your nose, out through your mouth. As you squeeze the pelvis, tighten the belly, lift your leg up. Don't forget to switch sides. It's the same exercise. We're just changing positions. Same exercise in all fours, because now there's a little more gravity that you're working against. Figure out how to inhale through your nose, exhale through your mouth, and find that deep transversus muscle with every exhale. Be mindful to not do this. A lot of times we use that rectus abdominis and start cheating. Your back should not change as you're engaging that deeper muscle. If this gets easy for you, try that in sitting. Use your hands on your belly, in through your nose, out through your mouth. Relax. Inhale and let your belly rise. As you exhale, squeeze your pelvic floor like you're trying to hold back gas. Pull it up inside your body. Tighten the lower belly like you're pulling up a zipper all the way up. Feel the tension under your fingertips. It should feel like your belly is getting pulled in the center. And relax and let go. And repeat. You can keep progressing this by trying this in standing. Try it when you're holding the baby. And remember, whatever you squeeze must relax.